Hi there, it's Johan here at iCommunicate. Did you know that on the 28th of August in New Zealand it's National Speech and Language Therapy Awareness Day? That's the day when we as speech therapists get to promote our profession, because many people don't know what we do. At the moment I'm actually in New Zealand, so I thought it would be a great time to tell you what speech therapists actually do. Okay, so let's sort out a couple of things first. I call myself a speech therapist, but in America and Australia I believe my fellow professionals call themselves speech pathologists. We all do the same work and we all have the same qualifications. We all need special training, we all need a degree in speech and language therapy, and we need to be licensed to practice. So if you ever get offered communication therapy from an unqualified, uncertified person, don't accept it. So what do? Some people think we just do elocution lessons, like the rain in Spain falls mainly on the plain. That's not exactly what we do. Let's start with children. Lots of children have speech delay or disorders or difficulties, and this can be caused by phonological problems, apraxia, cleft palate, stammering, articulation problems, hearing impairment, selective mutism, even voice problems. Children may also have difficulties with language, expressive and receptive language difficulties, listening and attention problems, auditory processing disorders, and attention deficit disorder. Of course, speech difficulties are often linked with literacy difficulties, another area speech and language therapists may be involved with. Did I mention hearing impairment? Whether it be glue ear or whether the child has a hearing aid or a cochlear implant, guess who is responsible for helping with communication development? That's right, a speech and language therapist. Yes, a speech therapist might be involved with all these children. So, what about children with autism? A speech and language therapist can play a huge part in working with children with autism. Working on communication skills and finding alternative forms of communication if the child cannot speak. We also work on social skills and teaching autistic children how to react and respond in various social situations. And we have strategies to help them to learn at school. Some children have special needs and may have genetic syndromes such as Down syndrome or Angelman's. Again, the speech therapist would be involved in focusing on speech, language and communication, as well as alternative forms of communication and learning. So what about adults? Well, adults have speech problems too, and voice problems, and stammering, and hearing impairment. Adults are more likely to suffer from a stroke, a traumatic brain injury, or progressive disease such as Parkinson's or dementia. A speech therapist might work with all these individuals with a focus on communication and cognitive development. Adults with learning difficulties also need help with communication, or to find an alternative form of communication, or develop their social skills. And the other misconception about speech therapists is that we just work on speech, but we work on any form of communication. This might be through the use of pictures, objects, sign, eye pointing, or a communication device. We might call that a low-tech device which is non-electronic, or a high-tech device which is an electronic device with voice output. And some of these new devices allow you to access the internet, email, text message, and have environmental control, so you can turn on the lights and change channel on TV. So there you have it. We do loads of amazing stuff. So if you see a speech therapist on the 28th of August, be nice to him or her. And if you want to find out more about speech therapy or communication disorders, come and visit our website www.icommunicatetherapy.com, where it's all about communication.